Good morning. Thanks for joining me on Drive North with Meg Ellefson. Very happy to have joining me this morning Dr. Peter McCullough. He's an internist, a cardiologist, and an epidemiologist, the chief scientific officer of the Wellness Company. He manages common infectious diseases as well as the cardiovascular complications of both the viral infection and the injuries developing after the COVID-19 vaccine in Dallas, Texas. Since the outset of the pandemic, Dr. McCullough has been a leader in the medical response to the COVID-19 disaster and has published pathophysiological basis and rationale for early outpatient treatment of SARS-CoV-2 infection, the first synthesis of sequenced multi-drug treatment of ambulatory patients infected with SARS-CoV-2 in the American Journal of Medicine, and subsequently updated in reviews in cardiovascular medicine. He has dozens of peer-reviewed publications on the infection and has commented extensively on the medical response to the COVID-19 crisis in multiple news sources, and has obviously testified in the U.S. Senate Committee on Homeland Security and Government Affairs and co-moderated 2 U.S. Senate panels on COVID-19 therapy and vaccines. Oh my gosh, that's a mouthful. Dr. Peter McCullough, thanks for joining me. I really sincerely appreciate it.
Thank you. I'm actually tired after listening to that long introduction. I also serve as the president of the McCullough Foundation. I'm in the McCullough Foundation offices today. But Meg, so great to join you on the program as you kind of venture out now in this independent podcasting world.
Yes. Isn't independent great? Being independent great?
I'm completely independent now in practice. So, I've always kind of been in some clinic system. And if we've learned anything through the pandemic is that we have to control our own destiny.
Yeah, indeed. And I think that's what I wanted to kind of dive into with you. We've spoken before when I was on broadcast radio, and just talk a little bit about and it had to be scary, frankly, and maybe this serves as inspiration for me to, what you were accustomed to doing, obviously, was being a provider within the whatever defined medical system, and then you decided, obviously, an entrepreneurial spirit and maybe libertarian spirit that provoked you to go out on your own.
In many ways, I didn't have a choice. The medical orthodoxy was essentially not going to treat COVID before hospitalization. And for the first 2 years, we had no government-approved oral therapy to even attempt to treat the pandemic illness, acute COVID-19. This was terrible. So essentially, the medical orthodoxy said, listen, people are going to get sick and be hospitalized. We're not going to do anything about it until they arrive at the hospital. Hospital is clearly too late. The majority of deaths that happened during the COVID-19 pandemic occurred in the hospital. The only way to prevent hospitalizations and deaths was to treat early in high-risk patients, and that's the reason why I published the McCullough Protocol, which was adopted by the Association of American Physicians and Surgeons, a group of independent doctors, and became the most widely used protocol in the world and is credited with saving tens of millions of lives and sparing hundreds of millions of hospitalizations. There's no greater capstone for my career.
So talk a little bit about, I did in preparing for our conversation, I actually did a little research again on ivermectin, and it still seems to me that information is difficult to find. It's as if if you compare it to another drug that's widely used, levothyroxine as an example, and I just wanted to compare what dosages are recommended, and to find any information on ivermectin is still, you have to conduct a deep dive in order to get any information on this drug.
Ivermectin has been, I think, one of the most suppressed drugs throughout medical history now. In 2015, Nobel Prize was awarded for work done on treating river blindness. We've used it extensively for scabies and other infections. We can use it topically on the skin for pustular acne and other problems. And it's a fully FDA-approved drug, very safe, safer than Tylenol. We found it to be the most dynamic and effective drug in acute COVID-19. It was in the McCullough Protocol by December of 2020. Dozens of randomized trials support the use of ivermectin. And to this day, it's actively suppressed. The FDA was sued by 3 doctors. They prevailed, and FDA took down its false information on ivermectin. But people to this day still scratch their heads. Why is there a war against ivermectin?
Well, and I guess that was going to be my question to you. I mean, is it really as simple as Big Pharma can't make any money off of it anymore, and that's why they don't want to promote it?
No, I don't think so. I mean, I prescribe over 90% of the drugs I prescribe are generic, like ivermectin. I think ivermectin's been singled out because the government authorities that really want to promote continued mass vaccination understand that if people really can readily access information on ivermectin and get prescriptions, that there would be no impetus for anybody to take a vaccine. So the government is, I think, specifically, and that we're talking CDC, NIH, FDA, is specifically suppressing ivermectin in order to favor continued genetic mass vaccination.
Do you find with the Trump administration and in particular Robert F. Kennedy Jr. That there is a little bit more acceptance or at least willingness to be more open-minded about these treatments?
It's possible. You know, it's funny you mentioned Robert F. Kennedy. You probably can't even name the last 2 HHS secretaries, which were Alex Azar and Xavier Becerra. No one ever mentioned them. There is a new set of leaders in healthcare in Washington. They're not set. We still don't have a Surgeon General. We have Dr. Jay Bhattacharya, who's leading both the NIH and the CDC, which is 2 behemoth agencies. We haven't seen really any endorsement of early treatment of COVID-19. No interest in investigating long COVID or vaccine injury syndrome, specifically the viral spike protein, the spine on the surface of the virus. This is what's made us all sick, is the little prickles on the top of the virus. They get stuck in the human body. So I'd say the current group in Washington, it's a mixed review.
So, I really wanted to, and I guess we can segue into it just by the conversation on medications, but I really wanted to talk with you. And I found it interesting because I was very skeptical when GLP-1 drugs came out, and I thought, okay, so this is the quick fix. This is the way to cheat what has always been recommended: diet and exercise, and watching what you eat, etc. But I learned, and it actually intrigued me because I see your company, the wellness company, carries a GLP-1 drug or I guess sells it, and I wanted to kind of dive in and get your take on GLP-1 drugs, and really ultimately let's start with what is GLP-1 and why are so many people in this country, I guess, deficient in GLP-1?
There was a recent paper in the major literature, I believe it was JAMA, indicating that 16% of patients have taken one of these drugs, and about 6% are currently taking it right now. An estimate is that 50% would be eligible. We're talking about glucagon-like peptide drugs. They're receptor agonists. So we have receptors in the stomach, the intestine, and the pancreas. And when we give these synthetic analogs that mimic natural GLP-1, then the urge to eat markedly declines, hunger markedly declines, and weight loss is facilitated. There's no doubt about it. So at the Wellness Company, we took this very seriously, and we devised oral capsule botanicals, and it's in a system called Appetite, to stimulate our own GLP-1. So that's probably the most desirable way to go. And then we featured a spray in the mouth of semaglutide, which is the peptide that's in Ozempic. Then we used a product called Drop, which was retatrutide. That was a triple-acting GLP-1 agonist compared to semaglutide, which is only a single-acting drug. And now we've settled on an oral dissolvable medication called Mounjaro or tirzepatide, and that's a dual-acting product. So we've changed our thinking over time, but we encourage people to start out with the Appetite system. and begin to get control over this and stimulate the natural production. I think that's most desirable. In clinical practice, I do prescribe Ozempic, Wegovy, Zepbound, and Mounjaro. But, that's in patients who are clearly obese or morbidly obese, have type 2 diabetes, and that's on indication. The shots are much stronger. They can have side effects, including muscle loss with weight loss. They can, in theory, stimulate what's called medullary C-cell tumors of the thyroid. And now there's actually legal cases arising over blindness developing with the shots. So I think the injections are going to go by the wayside. Even Eli Lilly and as well as Novo Nordisk, the big drug makers, they're going to have oral preparations that are going to replace the shots.
So, and I think this is part of my skepticism, is that there really hasn't been a lot of data out there, or at least these drugs haven't been in use for long enough to determine long-term effects. I mean, do you have...
Hang on, Meg. I disagree on this. The first drugs entered the market now about 20 years ago.
Wow.
And I've used them extensively. They started out with exenatide. They've been through large randomized trials. They clearly cause weight loss. They're favorable for kidney disease, favorable for heart disease. So I think we're okay, honestly. With any product, there are risks and there's benefits. And the safety profile is well characterized. I think it's going to get safer when we get to the oral prescription drugs, and we're already there with the wellness company with oral Mounjaro.
Well, and let's talk about the oral Mounjaro and that particular product and why you decided to. I mean, because in looking at the wellness company website, that looks to be the one that you are selling and I guess or prescribing, I guess I should say, and as opposed to, and I know you said the semaglutide is just I'll let you use the medical language for it, but it's not as effective, I guess, is what I've read.
Mm-hmm.
The semaglutide isn't as effective as the tirzepatide, and so can you talk a little bit about that and why you have moved towards that drug?
Well, what we're trying to do at the wellness company is to get to much lower doses, but higher absorption through the natural, a topical application of these in the mouth. So that's the real innovation. Instead of getting a high dose shot and having side effects, getting to a low dose. And the tirzepatide or the oral Mounjaro, it's in the peptide itself is in. It was called an aquasome capsule that allows it to survive, in the alimentary tract and then get absorbed. So we think this is the way to go. We get tremendous positive feedback from patients, and patients can go online. They do have to, fill out some forms, make sure a doctor approves it. But it's a lot better than trying to go to the pharmacy, fight with insurance, and start working with needles and injections.
So I'd like to talk a little bit about why you added, because I've seen tirzepatide, from other providers, but it appears, have added the B6 and the B12. Can you talk specifically about why that's so important to add those vitamins to the regimen?
When the body's under catabolic strain with weight loss, there's actually a higher need for B vitamins. So we found an opportunity to just add B6 and B12 in there. Some patients actually genetically, absorb less of this in their stomach and proximal intestine. And so if we're going to cut off the urge to eat, we want to make sure patients are replete. I tell people who are losing weight, they should take a broad multivitamin. The one I like the best is GNC Active for women. That's very broad-based and complete. And then, those at risk, you can even supplement more with the B vitamins. So.
All right, so behind you is something I can see that says McCullough Foundation. Can you talk a little bit about your foundation and what I guess inspired you to start it?
McCullough Foundation was started in 2022, became operational in 2023. It's a 501c3 not-for-profit organization that has four major pillars or aims. The first is investigative scholarship. The second is our efforts in the media, like today. And the third is our consultation in legal cases in the justice world. And then the last is public policy. And you mentioned a testimony in the Senate, the House. We've had White House press conferences. In fact, two of our members, John Leake and Nick Holscher, will be in Washington in just a few days at some major presentations. So McCullough Foundation has had a huge impact. Our scholarship, for instance, on the risk factors for autism literally changed the CDC's policy and their stance towards combination vaccines and autism. Our recent work on measles and the trade-off of infant death after measles vaccination versus the natural measles has really got the community talking.
Do you find, and I know I asked you this already in a different way, but do you find that the current presidential administration, I mean President Trump and his administration, are easier to, I'm trying to formulate this in my head, but are better to work with, or are more apt to, and I guess cancel anyone that has an alternative point of view? I think that was, what we saw, and of course during the COVID pandemic, and just in any physician or anyone that spoke against what was the narrative that was prescribed by, the medical community at the time.
I'd say the best aspect of the new administration is we have a welcome sense of reduced censorship, which is terrific. We have a growing sense of increased medical freedom. But if we've learned anything, the government does not deliver health care. They can't take care of individuals. They can't make people healthy again. People have to do that themselves. Now, they've started the conversation, and that's wonderful. But I think we should stop looking to government administrations regarding health. This is an opportunity. People can engage with the Wellness Company, McCullough Foundation, so many other organizations. Do their own research. Get their knowledge base to where they're comfortable, and then take action. We're seeing rises in heart disease, cancer. We've been through the pandemic. I think everybody needs to take stock of their health and take control of their health. They should stop looking to the government. You mentioned the current administration. Oh, my Lord. If you look at the distractions from, protests in Minneapolis and immigration in Greenland and Venezuela and Russia, Ukraine, and the Mideast conflict, now an attack on Iran, the Epstein files. I mean, it just keeps going and going and going. If I had one, adjective for the current administration, I would say distractive.
Mm-hmm. Absolutely. So, do you have any, compelling stories from either patients or even former colleagues or new colleagues that they were perhaps they had the mindset that we talked about from the past, where people just automatically accepted whatever the medical complex, industrial complex prescribed, versus were they inspired by, do you have a story about that? Were they inspired by you, or just inspired by the movement that you can describe?
Well, certainly McCullough Foundation has hundreds and hundreds of supporters. Many are so grateful of our work. The McCullough protocols for early treatment of COVID-19, McCullough protocol-based spike protein detoxification for those who have long COVID and have taken the vaccines, and certainly our work on childhood vaccines, food dyes, bird flu, monkeypox, and the list goes on and on. And yes, we have so many patients. One, he's featured on McCullough Foundation website. He's my patient, Steve Kempen. Now, he worked for a pharmaceutical company. He had a prior blood clot about 10 years ago, and his company encouraged him to take the vaccines. And he ended up taking 2 vaccines, suffered more blood clots to his lungs, had a third one, even had more blood clots, proven heart damage by MRI. And it's racked his nervous system, GI, autoimmune problems. And so we became involved with Mr. Kempen, and we actually sent his samples to a research lab in Germany. And after 3 shots of Pfizer, we found the Pfizer vaccine circulating in his blood 3.6 years later after the shots. He had heavy amounts of spike protein in the blood, in his skin, had fragments of DNA contamination from the vaccines in his bloodstream. And we did 2 sets of samples. I mean, this is proof positive that the vaccines don't get out of the body and they cause tremendous damage. And we're talking about the Pfizer and Moderna messenger RNA vaccines.
Is there hope for him? I mean, is there hope for others that have been injured by the COVID vaccines?
The greatest hope is the McCullough protocol-based spike protein detoxification. Wellness company sells that as the ultimate spike detox. But if you go on Amazon, you'll find dozens and dozens of product combinations that are following my protocol, which is copyrighted my name. And that's a combination of nattokinase, bromelain, and curcumin, which are natural products, along with some added minor ingredients. And yeah, people need to be on this for about a year or more, and we start to see the spike protein levels go down in the bloodstream. We've learned that the spike protein and the vaccine come out in sweating, Meg. So we're now advising people to get saunas, little home saunas. You can get infrared saunas that set up like a little teepee, go in there and sweat daily and get this out of the human body. My next patient coming in a minute or two took the shots, has had an acceleration of an early form of cognitive decline. His COVID antibody levels were about 8,000 units per ml. A safe level is below 1,000. Now, after I think about 6 months of detox, he's already in the 6,000 range. So he's on the way down. We want to see a 20% decline, and he's well on his way to recovering. Thank goodness he came in. I think if he didn't, he would have had progressive cognitive decline, maybe ended up in a nursing home.
You know, and I guess that's what I wonder too, is the effect that those who have had a COVID shot or shots have on those of us who haven't, and being around them, and if it's unhealthy to, and I don't know how you can control that, because I mean, if a person that's non-vaccinated is potentially exposed to someone that is, I mean, there's really no way of knowing if that's what's harmed you in any way.
So true. We know the spike protein in a paper by Banzel and colleagues, it actually is exhaled from the breath in little phospholipid packets called exosomes. So it's possible for you to get a spike protein exposure from someone else. We think this is probably red hot in the first 6 months after vaccination. And so we advise, to be careful on close contact. Based on my understanding, virtually no one has taken shots now in years. Even our CDC uses the National Infectious Disease Survey, which is a robo phone call, asking people their likelihood in taking the shots. The actual percentage of Americans taking the shot, based on my understanding, is probably under 1%. Meg, do you know anybody who's still taking shots?
Well, I knew very few even in the time, because it's just, it's something that, I don't know, we just, we tend to steer clear of people. But, it's tough. It's tough not to be, and I'm curious about your reaction, I mean, as a professional too, but just, it's hard not to be cynical about a lot of this. And I mean, I don't like to discount anyone's suffering or when I hear about somebody that at one time or recently was healthy, and then all of a sudden they're stricken with a turbo cancer or whatever. Mm-hmm. It's tough not to conclude, oh my gosh, did they have the COVID shot? And is this indeed what is causing their ailments today?
The pandemic was clearly the largest health event for our nation and for the world, for sure, in the last 10 years. Yet this mental oblivion to the pandemic is astonishing. Time magazine had on its cover in 2025 a whole issue, an article about turbo cancer. It said, why are all these cancers developing in young people? And it's true that cancer was on the rise before the pandemic, but it really took off. And they interviewed tons of scientists and experts, and they considered pollution and microplastics and childbirth changes and all kinds of other things. But they did not consider the pandemic, as if it never happened. I mean, it's the most amazing article to read. And I recently summarized this on our Substack, Focal Points, thefocalpoints.com. You can take a look at this. I mean, it is an astonishing lack of recognition that the pandemic has had lasting effects. And I think for problems like blood clots, kind of long pandemic syndromes, and cancer, I think both the infection and the vaccines are increasing our risks. So it's true. I didn't take the vaccines, Meg. And you know what? I think now I'm at increased risk of cancer just because I've had the infection.
Wow. So it's not just the messenger RNA technology. Right. It's and you know, what are the repercussions to, I mean, I know that there are many that, I don't know, claim that it was the origins, but I mean, I think we also know too, or at least there are many that suggest that the American government was instrumental in developing the virus to begin with, and through Dr. Fauci and others, and that's what's concerning too, is that our own government would I don't know, conspire against its people. It's frightening.
It's scary. It's the reason why Dr. Fauci was given a 10-year preemptive pardon, almost certainly because he helped the team create the virus. The virus is an artificial virus. It's a human coronavirus, but it has the spike protein from a bat that's been engineered to invade and kill humans. The spike protein reduces our resistance to cancer. That's the reason why the infection is linked to increased cancer. The spike protein causes blood clots, heart damage. It's found in the brain, in bursted blood vessels. I mean, it's a disaster. So this is a mind-blowing reality that Anthony Fauci is part of this co-conspiratorial team with the Chinese to create SARS-CoV-2, and then he asks for a preemptive 10-year pardon. He knows he's guilty. He's guilty of fraudulent concealment and mass negligent homicide. And he knows it. And this is in the wide open, Meg. So I think everybody should be on their guard regarding cancer, for instance. A leading cause of death is now colon cancer under age 50. Well, that means anybody with any signs, we need to actually get colonoscopies earlier. There's now a fecal genetic test called the Cologuard, and now a blood test called the Shield by Guardian. So we need to get after colon cancer screening. I'm examining every man in terms of testicular exam, prostate exam, getting the PSA. We can't be vigilant enough. We're seeing people now actually die of cancers in their 60s, the types of cancers people get in their 80s or 90s, like prostate cancer.
Wow. And as you said, that's not attributable to the shot exclusively, but because of our exposure to the COVID virus.
That's true. I believe it's due to the COVID virus as well as the shots. It's due to the spike protein. Everybody should get a blood test to indicate what their spike protein exposure was. So you can do this. It's called a COVID antibody test. Go to LabCorp, Labs on Demand, Infectious Diseases, COVID-19 antibody, and get your test. You can sign up on LabCorp, pay $69, get a user ID and password, go into LabCorp and get your result. If you're under 1,000, you're free and clear. If you're over 5,000 units per ml, I'm worried about spike protein in the blood. 10, 15, over 25,000, watch out. You're in trouble. I'm seeing spontaneous blood clots, cancers, all kinds of problems.
Dr. Peter McCullough, thank you for joining me. I sincerely appreciate it. It's great to reconnect with you, and I hope we'll keep in touch. You know, there's never a shortage of topics we can discuss. I mean, it's human nature. There's always going to be something. So thank you so much, and thank you for all that you're doing too. And God bless you for your willingness to speak out long before anyone else was willing to do it, to have the courage to do so.
Oh, thanks so much, Meg. Make sure you visit McCullough Foundation, www.mcculloughfnd.org, and see our work and support us there. Visit the Wellness Company, twc.health/focal points. And, Wellness Company and the McCullough Foundation are leading the way in terms of investigative scholarship, wellness companies providing the solutions that we need to navigate. I'm sure the wellness company will play a huge role in the next pandemic if we have one. I'm Dr. Peter McCullough. Thank you so much for having me.
Thank you, and please give my best to John and Nick, and look forward to talking with them in the future as well. Take care.
Thank
you. All right, I'm out.
Okay, I'm going to leave it on. I have to get ready, but thank you so much. And we